Well, Teresa, according to my understanding, the baby is doing well. Typically, women over the age of 35 have an increased chance of carrying a baby with a birth defect. However, there's nothing to worry. But we would suggest that you consider having an amniocentesis for photochromosome testing, just to make sure the baby is the healthiest it can possibly be.
What exactly is amniocentesis, Dr. Harvey?
Yes, I'm sorry, I didn't explain. Amniocentesis is the sampling of amniotic fluid using a hollow needle inserted into the uterus. So deep right here, and it's then sent to the lab. The fluids from the amniotic sac are then sent to the lab and screened for developmental abnormalities.
I'm a little concerned here. This sounds somewhat dangerous. Are there any risk factors involved?
Yes, I mean, like various procedures within the hospital, there's always going to be risk factors. However, let me start off by saying the needle injury is rare. It is caused if a baby is to move an arm or leg into the path of the needle. Yet our professionals are trained to effectively and steadily carry out the procedure. There's also a 1% chance of a possible miscarriage. Take this pamphlet and educate yourselves. That's right over here. This pamphlet will explain to you exactly what risk factors are involved in this procedure. How about you go home for a few days, relax, research amniocentesis, and give me a call on your decision.
Okay, that sounds like a great idea. Thank you, Dr. Harvey.
If you do have any questions, you know my phone number. I would suggest this procedure, of course, but I'd suggest it be done in within the 16-week post-conception. No rush, but the sooner, the better. Anything else I can do for you guys?
No, that is all.
Okay, thanks. Have a great day.
It was nice meeting you guys.
You too.
Yeah.
Sorry I'm late, guys. Give me a second here. How you guys doing? How have you
Good,
been?
how are you?
How'd the procedure go?
Hi.
Went well, yes. Thank you.
Alright, well, thank you for patiently waiting. I have the results from the lab back, and I need your full attention at this time.
Oh, no, Dr. Harvey. I was kind of worried we wouldn't hear any bad news. I've been nervous all week.
Well, the reason the both of you decided to undergo amniocentesis is because you wanted to provide a steady foundation, a good path for the growth of your child. And so with the information I'm about to tell you, your family will be able to prepare for and or make some decisions upon the future of your baby. The karyotype, which is the visual appearance of the chromosomes, reveals that your child has Turner syndrome. I know this is a significant amount of news to handle, but there are plenty of options for the family to explore during this time.
How could this be? Our families are extremely healthy. And what the heck is Turner syndrome? Is it like a development disorder? I can't believe this.
I'm sorry. I know you must be feeling very sad, but there's a lot of information to be discussed. To be quite honest with you, I do not have any further answers. The delegations of my job require me to administer the child throughout pregnancy and report lab results. I'm unaware of the treatment and symptoms. I am going to refer you to a genetic counselor, though. A good friend of mine, actually, who will be better suited to educate you upon the disorder.
I just don't know what to do. I'm so scared.
You'll feel a lot better when you understand. Please don't feel discouraged. Be strong for your child.
Well, thank you, Dr. Harvey. We need an appointment with a genetic counselor immediately.
Alrighty, I'll get that done as soon as possible.
Thank you.
I'm sorry again.
Hi, Teresa and Rick.
Hi, how are you?
Nice to meet you guys. I'm the genetic counselor. There we go. So according to my understanding, your child has been diagnosed with Turner syndrome.
Yeah, we have educated ourselves briefly about Turner syndrome. There are various websites and books out there. I just find myself becoming more and more discouraged as I research.
I understand. Would it be okay with you if I discuss Turner syndrome as a whole? Once I'm finished, feel free to ask any questions you like. We're going to make a plan together, weighing out multiple options for you to discuss back home. I don't want you to feel discouraged. I want you to feel empowered and relaxed.
Yeah, that would be great. Thank you. Please carry on.
Alright, well, Turner syndrome is caused by a missing or incomplete X chromosome. Normally a child inherits an X chromosome from their mother and an X chromosome from their father. In this case, your child is missing one of their X chromosomes. If a pair of sex chromosomes fails to separate during the formation of an egg or sperm, this is referred to as a non-disjunction. When an abnormal egg unites with a normal sperm to form an embryo, that embryo may end up missing one of the sex chromosomes X rather than XX. As the embryo grows and the cells divide, every cell of the baby's body will be missing one of the X chromosomes. Therefore, this abnormality is not inherited from an affected past or an ancestral lineage, because women with Turner syndrome are usually sterile and cannot have children. So the genes affected are involved in growth and sexual development.
Oh, this is a lot to handle. I just, however, somewhat feel a little bit better that my wife nor did I pass on these genes to our child, Regina.
I like how you're thinking positively, Rick. This is exactly how we need to progress. In terms of chromosomal disorders, I often have families come in here with babies who have been diagnosed with a disorder such as Down syndrome. Now, Down syndrome affects language and communication skills. One would describe this as some degree of mental retardation. In your case, however, is a daughter who will most likely attain normal intelligence with good verbal and reading skills. Some girls have problems with math, memory skills, and fine finger movement. Unlike a severe development disability, you will be able to interact with your child and she will interact with you. You see, this is how we need to think. There's always someone in a harder situation, Teresa.
You really have positively changed my way of thinking. I'm eager to hear more. So other than these possible symptoms, what others are there?
Yes. Well, girls who have Turner syndrome are shorter than average. At puberty, they do not have the usual growth spurt. Non-functioning ovaries are often another symptom. Girls with Turner syndrome do not start their periods or develop breasts without hormone treatment at the age of puberty. Those are the most prominent. However, there are other symptoms such as arms that turn slightly at the elbow, minor eye problems which can be corrected by glasses, scoliosis, obesity complications, and osteoporosis. There are a lot of possible symptoms. Here's a pamphlet describing the physical appearance of this chromosomal disorder.
I feel much more at ease. It seems to me that this disorder basically affects development in females. Besides the appearance and future symptoms of this disorder, our child will be relatively normal, correct?
Exactly. With appropriate medical care, early intervention, and ongoing support, a girl with Turner syndrome can live a very productive and happy, healthy life.
We have 2 children. One is away in college, the other is on her way. My concern is affording this disorder, the financial aspect of it all. I just don't know if we will be able to finance this.
That is an extremely weighty component. I don't know what the future will hold for your child. Most likely, the purchase of growth hormone will be a financial need. Other complications could occur down the road, which may seek additional charge. Your income and insurance are factors considered along with determination and drive. I have to tell you something. There are a few options on the table. To state them simply, they are parenthood, adoption, and abortion. This may be something that you would like to discuss in private. Either way, once you come to this conclusion, perhaps speaking with your older kids, we can then go into set a future plan.
The topic of abortion and possible parenthood all need to be discussed at home. We really appreciate this appointment today. It's been wonderful.
Oh yeah, no problem. If you have any other future concerns or questions, just call me.
at 6. Like, seriously?
Can you turn that down?
What you talking about, no?
Turn it off now! That should not be a problem. Your father and I have no plans tonight. We want to talk to you about something important regarding the baby.
I know, I'm gonna have responsibility, whatever. I don't...
No, Regina, this is serious. It's about your sister's health.
Is everything okay?
Everything's okay for now, but doctors have informed us that your sister has been diagnosed with a chromosomal disorder known as Turner syndrome.
What's Turner syndrome? Like, will she be able to speak and, like, do stuff?
Well, Regina, your sister will be developing differently. She will be infertile. She won't be able to grow like you are at your rate. She will be shorter and will need help from hormones to grow.
So her only problem will be, like, height and infertility.
Possibly, but there are just so many symptoms which could develop as she does. In early childhood, girls who have Turner syndrome may have frequent middle ear infections, which could render her incapable of hearing. There are just so many problems which can be associated.
Well, what can I do to help? I don't know what to think right now.
As you know, your older sister is in college, and soon you'll be in the same place. You're old enough to understand that there are appropriate options to discuss. And as you know, the baby in your mom's stomach is not fully developed, as you can see by her stomach. And the genetic counselor said that we should discuss 3 options, which are parenthood, raising the baby, adoption, and abortion, terminating the baby.
Abortion? How is that even an option? That's so sick. Like, why would you even think of killing my baby sister? Like,
Regina, I don't appreciate your tone. Your father and I know a lot more about this issue than you do at the current moment.
well, I know abortion's wrong, and that's all I need to know.
Enough!
Calm down, Regina.
Regina, I understand where you're coming from. Your father and I are not pleased with the idea of abortion or even adoption, you know, but you have to understand that I don't work. Your father only makes $75,000 a year. We have 2 children in college, a dog, we have a house, and now a child with a growth disorder. This is going to be a lot of money on top of what we already can barely afford. And what if he loses his job? We're self-insured, but that is only so much money. There's a lot on our minds right now.
Well, what about if, I don't know, if I don't go to college and, like, help you raise the baby?
No, that is not going to happen. You are going to live a productive life and receive an education. We just wanted to hear your opinion on the matter.
I just think that abortion is something this family would never do. I mean, I know some circumstances require it, but I just don't think this is one of them. I don't even know much about Turner syndrome, but I know that this is my little sister, and it's in your stomach, and I want to do everything I can to help her.
Your mother and I agree. We feel as if abortion isn't what we're meant to do. Your mom even had a nightmare last night about it. So we don't want to give up on this child, and we could possibly move out of this house and find a small apartment.
I won't give up on this kid. I think we have to provide for this child. Regina said it herself. I mean, I do not want to abort or put my daughter up for adoption. She will stay with us, and we will make room for her no matter what the circumstances.
Calm down, Regina. Calm down, Regina. You have to understand that you don't understand. Be a great young lady and a great big sister to this girl.
Thanks, Dad. I'm going to help her be a successful, inspiring woman.
That's it.
Oh, word?